Tuberculosis, often referred to as TB, is a serious infectious disease. It primarily affects the lungs but can also impact other organs. TB is caused by a bacterium called Mycobacterium tuberculosis. This bacterium spreads through the air from person to person. When someone with active TB coughs, sneezes, or even talks, tiny droplets containing the bacteria are released. These droplets can linger in the air for hours. People nearby can breathe in these droplets and become infected. It's important to remember that not everyone infected with TB bacteria becomes sick. There are two types of TB infection: latent TB infection and active TB disease. People with latent TB do not feel sick and cannot spread the bacteria. However, they can develop active TB disease if their immune system weakens. Active TB disease often causes noticeable symptoms. The most common symptom is a persistent cough that may produce blood or phlegm. Other symptoms include fever, chills, night sweats, loss of appetite, and unexplained weight loss. TB is most commonly spread through close contact with someone who has active TB disease. This is why it's crucial to identify and treat active cases promptly. Factors that increase the risk of transmission include living in crowded conditions, having a weakened immune system, and lack of access to healthcare. If you experience any symptoms of TB, especially a persistent cough, it's essential to see a doctor right away. Early diagnosis and treatment are crucial for preventing serious complications and stopping the spread of the disease. Diagnosing TB typically involves a combination of tests. Your doctor will likely start by asking about your symptoms and medical history. They may perform a physical exam, listening to your lungs for any abnormalities. A skin test or blood test can determine if you've been infected with TB bacteria. If these tests are positive, further tests like a chest X-ray or sputum culture will be needed to confirm if you have active TB disease. Treatment for active TB disease usually involves taking a combination of antibiotics for several months. It's crucial to complete the full course of treatment as prescribed by your doctor, even if you start feeling better before finishing all the medication. Preventing the spread of TB requires a multifaceted approach. This includes early detection and treatment of active cases, vaccination programs in high-burden countries, and public health measures to reduce transmission. TB is a global health concern, particularly in developing countries with limited access to healthcare resources. Poverty, malnutrition, and overcrowded living conditions can contribute to the spread of the disease. While TB can be a serious illness, it is treatable and curable, especially when detected early. By raising awareness, promoting prevention strategies, and ensuring access to quality healthcare, we can work towards a world free of tuberculosis.